We talked yesterday. We had two relevant stories yesterday to what we're going to talk about now, which is firings related to people who are refusing to get vaccinated for their jobs as required by their employers. Yesterday, we had two stories sort of about this. One story asked, is it time to start firing unvaccinated employees en masse, so to speak? That was one question we talked about yesterday. Many of you wrote to me and said, yeah, it is. Once you say those are the rules, you've got to follow through. Otherwise, these are empty threats. It's like the parent who makes an empty threat to the kid, or I don't know, whatever analogy you want. The second question we asked yesterday in another segment, and many of you wrote in about this one as well, is, are some of the people saying they're going to quit over a vaccine mandate lying or exaggerating, or maybe even misunderstanding their own willingness to quit, and they're not really going to quit? They're probably just going to go and get vaccinated. And one of the examples we had yesterday was Massachusetts state troopers, where the union for the state troopers said, we've gotten dozens and dozens, massive dumps of resignation letters. The union said that. But state police human resources said one trooper actually resigned. Now, we'll see how it all shakes out. We now have a couple of additional data points, and it seems as though there are people willing to quit, but more likely be fired over not getting vaccinated. But yesterday's assessment that it might only be half to 1%, half of 1 to 1% of employees at any given organization may well be right. Let's look at a couple of data points. Washington Post reporting, North Carolina hospital system fires about 175 workers in one of the largest ever mass terminations due to a vaccine mandate. Timothy Bella writes, a North Carolina-based hospital system announced Monday that roughly 175 unvaccinated employees were fired for failing to comply with the organization's mandatory COVID vaccination policy. The latest in a series of healthcare dismissals. We're going to get to that. Novant Health said last week that 375 unvaccinated workers across 15 hospitals and 800 clinics had been suspended for not getting immunized. They were given 5 days to comply. Novant Health spokeswoman Megan Rivers tweeted Monday that almost 200 of the suspended workers received their first dose by Friday. The hospital confirmed that the rest of the suspended employees who did not comply were fired, although the exact number of those dismissed was not specified. We stand by our decision to make the vaccine mandatory, as we have a responsibility to protect our patients, visitors, and team members, regardless of where they are in our health system. We couldn't be prouder of our team members who made the choice to receive the COVID-19 vaccine and remain part of the team. Later, the article says the mass termination of unvaccinated hospital system employees is among the largest of its kind to date. More than 150 healthcare workers who didn't comply with the mandate at Houston Methodist, which was one of the first to require the shots, were fired or resigned in June after a federal judge upheld the policy. And importantly, more than 99% of the system's 35,000 employees followed the program. We have a few other data points here as well. Becker's Hospital Review put out yesterday a sort of summary of departures at 18 different health systems. Now, departure could be firing or resignation. It could be either. And it includes St. Luke's University Health Network, 17,000 employees. About 150 total refused to get vaccinated and resigned. That is just under 1%. Newark, Delaware's Christiana Care fired about 150, or the equivalent of under 90 full-timers for not complying. In New York City, New York Presbyterian's 48,000 team member system had fewer than 250 resignations/firings. That is about half of 1%, right along with our estimate from yesterday. New Hyde Park, New York's Northwell Health had about 24 leaders not allowed to continue. We don't know the total number there. So you can go and look at the exact numbers here. But what are we learning so far? First and foremost, it does seem that when there's a disproportionate amount of headlines about people resigning or people saying, fire me, sirs, that the real number of people willing to go, and whether it's a resignation or a firing, it doesn't really make a difference. It seems that it's about half of 1% to 1%. That's number one. The second thing here is, when it comes to healthcare systems, this is not just about the employer in a vacuum saying you got to be vaccinated and otherwise you're out, with no real connection to reality. This clearly also has to do with patients. And what they should do is the nurses that don't want to get vaccinated, the administrators that don't want to impose vaccination, if there are any, the doctors that don't want to get vaccinated, they should start their own clinic. They should start their own hospital. If patients prefer to go and be seen at a place where the employees, nurses, and doctors might be vaccinated or might not, but it's not required, if that's more appealing to participants in the healthcare marketplace, because that's what it is in the United States, if people would rather go to the place where maybe the employees and service providers, health providers aren't vaccinated, then that would be a business. Open a clinic and say, hey, if you want freedom, come be seen here. Come to our ER. We don't make the nurses get vaccinated. We don't make the doctors get vaccinated. If that's a popular idea in the marketplace of ideas, then do it and it will be very profitable. My prediction is most people who go to a healthcare setting want to go somewhere where they know the people providing care to them have been vaccinated. But this is a great opportunity to test it. What do you think would happen in that situation? Let me know. You can find me on Twitter @DPACman.